So hello, I am Sandipan Das, second year computer science and engineering student of JIS College of Engineering, and I am also the 6th placeholder of the Innovative Idea Competition Eradicate organized by IEI Student Chapter EC Department of JIS College of Engineering. So let's talk about the idea. So my innovative idea to fight against COVID-19 is to make a auto health monitoring system. So now we all are aware about the fact the horrible outbreak of the coronavirus disease COVID-19, and as per World Health Organization, home quarantine is intended for the people who believes that they have been exposed in COVID-19 and they are required to be in home quarantine to prevent community transmission. Now it is not possible to monitor so many people who believes that they have been exposed in COVID-19 or who have the symptoms for 2 consecutive weeks during their home quarantine. So now if we have a auto health monitoring system by which patients health conditions can be recorded automatically, and doctors also can conclude or came into a decision that the patient is required to be hospitalized for further treatment or not. So let's talk about the approach towards solution. So in this case we have to keep tracking the health records of a patient on a daily basis. So we can make a portable or a wearable device that patient will be wearing throughout the day. The device will be consisting of sensors to sense the body temperature, blood pressure, heartbeat rate or other certain parameters. The sensor will generate data and that generated data will be captured by a device like NodeMCU. We will develop an application to receive the data sent by that NodeMCU and store it into a database. After storing the consecutive 14 days health records, our application will be able to make a statistical analysis and plot a graph, and it will be sent to a local hospital or to the doctors, and our statistical data will be able to identify or determine that whether the patient's health condition is critical or not, or he or she is required to be hospitalized or not. We can also upgrade the functionality of the application, where after storing the consecutive 14 days data, our application will be able to run a predictive analysis on the dataset stored into the database, and then the application itself will be able to determine whether the patient is required to be hospitalized for further treatment or not. So that's all about my idea. As an engineer, we also have some responsibilities towards society, and I will be very thankful if my idea will be helpful for our society. Thank you.